To control outbreaks, nurses must master the chain of infection. It begins with the infectious agent, pathogens like bacteria, viruses, or fungi. Rapid identification and diagnosis are your first line of defense to break this initial link.
Next is the reservoir, the habitat where the agent lives and multiplies. This can be humans, dirty equipment, or the environment. Rigorous cleaning, disinfection, and standard precautions eliminate these hiding spots.
The pathogen needs a portal of exit to leave the reservoir, often through respiratory tracts, open wounds, or bodily fluids. Proper waste disposal and wearing appropriate PPE like masks prevent the agent from escaping.
The mode of transmission moves the pathogen to a new host via contact, droplets, or air. Hand hygiene is the single most effective way to sever this connection and stop cross-contamination.
Pathogens invade through a portal of entry, such as mucous membranes, broken skin, or catheters. Maintaining strict aseptic technique during invasive procedures guards these vulnerable entry points. Finally, the susceptible host. Patients are vulnerable due to age, illness, or surgery. We protect them by treating underlying conditions, ensuring vaccination, and maintaining a safe environment to break the final link.